again, welcome to BIOLASE's Advancing Dentistry webinar series. We are very excited to welcome Dr. Louis Malkmacher as our speaker. The lecture this evening is titled Changing the Face of Dentistry, a look at fractional laser skin resurfacing. As always, we are hosting tonight's webinar on Zoom and welcome your questions. Dr. Malkmacher has a lot of fantastic content to go over with you. So we'll try to save just a few minutes there at the end to address those. And if we can't get to all the questions, I will give you instructions on how you can submit any questions or feedback to us at the end of the webinar. Tonight's lecture is timed with the release of the Renew fractional handpiece for the Waterlase I+ laser. So for more information about the fractional handpiece, you can visit biolase.com/renew. And I will give you some more information about that website at the end of our time together tonight. At the conclusion of the lecture and Q&A, I'll provide information about BIOLASE Education CE process, along with additional web resources you can access to continue your learning journey in laser dentistry at our education website, which is education.biolase.com. I'll also be highlighting a few of our upcoming Waterlase and fractional courses. Believe it or not, it's almost 2024, and we have a few great courses coming up early in 2024 that I'll let you know about. This webinar is being recorded and will be posted on our webinar library at education.biolase.com in the next day or two. I'll also highlight our upcoming webinars you can register for. Our next one and final one of 2023 will be on December 5th, and it will be focused on social media marketing tactics. So really excited about that one. So with that, let me formally introduce our speaker. Dr. Louis Malkmacher is a practicing facial aesthetic dentist in Cleveland, Ohio, and an internationally known lecturer and author, known for his comprehensive and entertaining style. Dr. Malkmacher is president of the American Academy of Facial Aesthetics and has trained thousands of dental professionals in facial aesthetics, dental implants, restorative dentistry, orofacial pain, bruxism, laser therapy, and dental sleep medicine. For over 4 decades, Dr. Malkmacher has inspired his audiences to truly enjoy dentistry by providing the knowledge necessary for excellent clinical and practice management. He has been named as one of the top leaders in continuing education by dentistry today for the last 26 years. So with that, Dr. Malkmacher, it's such a pleasure to have you with us. Excited about your lecture, and I will hand it over to you.
All right, I appreciate it. Thank you, Joseph, and thank you to BIOLASE for hosting me, and really thank you to all of you for being on, spending your time with us. And I'm going to dive right into this because I'm going to try to jam a lot of information into a short period of time. So feel free to ask questions. We'll probably, take some questions at the end, or we'll try to get to them as we go through. So I'm going to jump in. There is a lot of video. Anything on your end that you don't, you can put on pause or stop streaming. I want you to have the best experience, and because we do have a lot of video to show you, that's the best way to show this. But changing the face of dentistry. I mean, that's really what it's all about. And just a quick introduction, just for myself. My name is Dr. Louis Malkmacher, as Joseph told you. American Academy of Facial Aesthetics has trained over 25,000 dental professionals in the use of neurotoxins, fillers, pedio threads, and now fractional laser skin resurfacing. And it all works together, as you're going to see. So there's my email if you have any questions about what we do, or about the AFE, or about this program. And there are a whole host of websites just as a resource if you want to take this picture or refer back to this, and we'll show it a little bit later on there as well. But if you all invited to go ahead and follow us on social media at Facial Aesthetics, where we post clinical content every day on the various different social media websites here. And we usually get a ton of training questions. So I really want to focus on our topic. If you have any training questions about foundational Botox and fillers, level 2, level 3, advanced, master, a lot of different courses we do, cadaver labs, PDO threads, please go to afetraining.com, and they always have a special whenever I give an online training. So here it is. You can save $500 off with the code AFE500. I've got an additional special for you later on towards the end. But here are our upcoming courses. So if you want, take a real quick picture of this slide or go to afetraining.com. And especially if you're interested in the fractional laser skin resurfacing, we've got the bolded courses on here coming up with BioLace. And the next one's December 1st at the BioLace Education Center. And then again in February, and then one in March at our Cleveland AFE Training Center. And they've got all kinds of deals for you. So if you want it, grab it before tuition goes up, because everything in the world is going up, unfortunately. So you can lock this in, take courses whenever you'd like in the next year or two. So it's really great. We also have permanent training centers on that line on top. So with that, I really want to go ahead and get to our topic here. And we have a great faculty, by the way. We probably have the best faculty. I know we have the best faculty of any other organization. And you can see, 70 plus, not even all, couldn't even fit them all in this picture here at our faculty summit. And I got a lot of them are dentists, and that's for sure. Many of them are laser dentists, just like many of you are thinking about getting into it there. So with that, I am going to, let's dive in as we go into this here. So it's always fun to go ahead and do this. So let's talk about skin. We're going to talk about skin, the dental scope of practice. How does this all fit in? So the nice thing about skin is always aging, and people are literally living forever because they're healthier. Certainly in the United States, they are healthier over time. But we've got so much we can offer now, especially as dental professionals, whether it's PDO threads, collagen biostimulation, whether it's neurotoxin that relaxes muscles for either oral facial pain or aesthetics, dermal fillers, and now to complete the picture, you need all of these things, and that includes the skin. I'm certainly going to show you a lot of before and afters as we go through this. And skin is part of everything that we do. I don't know if you know that. We're going to be talking about all these smile lines and lip lines, everything around the face. That's all part of dental aesthetics, and dental aesthetics is all part of facial aesthetics. And certainly the skin is an important part of all of those things. It's all connected, in our minds, in the past. I can tell you when we started the AFE 15 years ago or whatever, it's been a long time already for that. Like everyone was questioning, well, can dentists do these things? I mean, neurotoxins and fillers, Botox, all those different things. And now we give our courses with the ADA at the ADA annual session at their headquarters on our own, about 400 courses a year on injectables. And again, most of the people that take our courses are dentists. Yeah, I think we've proven that we can do it and safely and do it just as well as anybody else. But let's talk about what are we trying to accomplish when we are talking about fractional laser skin resurfacing, and what is it? We're going to talk about all those things for that. But a large part of it is going to be building collagen. And this is going to be in the dermal layer. You've got the epidermis on top, the dermal layer underneath, and building collagen. And that is really the foundation of good, healthy skin. It's the foundation of smile lines and lip lines and all of those different things. What I really want to do is kind of go ahead and give you a little bit. I'm going to kind of jump the gun a little bit, show you some examples of what we're going to do, and then come back and explain it in a little bit more detail. And like I said, we have a lot of video for you. What is fractional skin laser resurfacing? Very simply, we are going to cause a little micro trauma in the skin. And as the body builds itself up, and as the body builds itself up with collagen underneath, that is going to completely rejuvenate the skin, pull the skin tighter, make the skin healthier. That all goes, as you'll see, to lip lines and smile lines and just about everything else. And that's actually what we're going to talk about right now. These are all the things, and when it comes to scope of dental practice, and certainly I have worked with nearly every single state dental board on all of these issues. It is really about what are you trying to accomplish. Documentation is so important. So all that we're doing is improving lip lines, smile lines, TMJ, bruxism, headache, migraine, which you can do with other kinds of lasers, but everything around this area and this area, because all of this is in the scope of dental practice in 99% of the states that are out there that you and I can treat, because this is all, I mean, it's really head, face, and neck. I mean, that's all of that because of therapeutics, because of aesthetics. There's so many opportunities. And certainly this patient right here that you see is a perfect example, because her smile got a lot better when you add Botox, fillers, PDO threads, fractional skin laser resurfacing. All that together gives her great dental aesthetics, which is really total facial aesthetics here. And again, it's all about documentation. That's really what it's about. And that is something with the AFE that we do when we train dentists, is we teach you how to practice within the scope of dental practice and document appropriately. So I want to show you, first video coming up, I want to show you just kind of an overview of what this procedure looks like and how it fits into your practice with this patient right here. So here we go. Let's show you some of the treatment on this patient here. And what we are going to do is go ahead and use the fractional laser skin resurfacing. And this is the YSGG with water. And that's what makes it so comfortable. So I just want to give you a little sense of it. So I'm going to go quiet for about 30 seconds so you can go ahead and hear the procedure and what it sounds like, so you get a sense of it. And then we'll shut that off and I'll come back on.
Okay, cool. You guys sound like you're doing a really good job. Oh, good. Does it feel like you guys? Yeah, it does. Okay.
We're back, and what you were hearing is that air spray and that click, click, click. That's the laser, and that's the fractional part of the laser skin resurfacing as it's putting down these microchannels very evenly across the face and very effectively. Now, few things about this procedure. Number one, you've got to go at a slow, steady pace, and that certainly comes with training, as you can see. That's about the rate that you want to go ahead and do that. Number two, compare this to any other kind of a procedure that is similar to this, and this is super comfortable because of the water spray. I mean, that just takes a lot of that out of that, a lot of the pain out of it. You could certainly use some topical anesthetic like a ComfortX BLT that we use many times for patients for a little bit extra comfort, but they really barely feel anything here. Now, again, you've got to adjust the wattage here, and that comes with training. Different parts of the face are going to have different parts of the wattage. But what is it doing there? It is going ahead and putting in these micro channels into the skin, and it is, again, imagine they're tiny little traumas in the skin, and what it's going to do is stimulate collagen production. Certainly, you get super collagen production with the combination of smooth PDO threads and fractional skin laser resurfacing with the YSGG, even more so. But what's really important is you also get skin tightening. Now, all of this relates directly to smile lines and lip lines. And this is all about, the oral area, the perioral area does not sit in a vacuum. If you go ahead and you treat the entire face, that is what's going to go ahead and give you that collagen production that is going to result in better lip lines and smile lines. Certainly going to go ahead and give you the skin tightening that is also going to give you. That's all part of the scope of dental practice in this area here. So now let's talk a little bit more about the procedure so you can understand that we are always staying perpendicular to the skin, and you've got to move certainly with all of this. And you can see it doesn't really, and you can control the water flow a little bit to whatever the patient is comfortable to, but it really doesn't involve a whole lot of water. We initially thought we would need a dental suction, but you really don't. Just some gauze. That'll get a little bit wet, and that's completely, not only distracts the patient, but it makes the entire procedure comfortable. Now, take a look in the procedure part of this too. You are always seeing you are leading with that water spray, and that's the direction you're going into. The tip that you're seeing there is a disposable one-time, one patient use tip on that. Every once in a while we need, if that tip does get clogged up because the patient maybe wasn't cleaned off well enough and you're getting some junk in there, so you're not getting it, but that's pretty rare. One tip per patient will do an entire face and neck and really all the areas around there. But these areas, the perioral areas, are super important where you want to go ahead and get the best results here. So everything in this, at a minimum, the cheek area, the lips area, lower lip, upper lip, as you're going to go ahead and see. But it's a slow, steady pace. If you're too fast, you're not going to get the result. If you're too slow, then you may be causing a little bit more damage than you than you really want in these patients here. Now, compare this to dentistry. You can literally see what you are doing, and that's nice and refreshing. Certainly learned that with injectables of Botox and dermal fillers and PDO threads. I mean, that's the nice thing about these extra oral procedures or these facial procedures, is that these are going to go ahead and directly, you can see exactly where you are, exactly what you're doing. This is a fairly quick procedure for most patients, so it is really a lot of fun to go ahead and do on these patients here. For patient expectations, it's really important to let patients know that this is probably going to take multiple treatments to get the result that they want, but really you can evaluate it, after every treatment, and it takes them 1 to 2 weeks to really heal up from this. They will definitely be, they'll have some redness here depending on how aggressive you are, and also their skin type, but that's always important. You've got to choose the right skin types for these procedures here. Certainly the lighter skin types will do the job very well, but it can really, really give patients, make such a difference to their overall skin, the tightness of their skin, the collagen biostimulation that you're getting, all part of this procedure. And again, you do combine this with other procedures here as well here. So just to give you, this is just an overall kind of a video so you can really get an idea of what we are trying to accomplish with this procedure. Patients absolutely love this procedure. Now, again, you've got different injectables are for different things. You've got neurotoxins are for treating motor muscles, and that can help in oral facial pain. That can help also in getting rid of wrinkles that are caused by those motor muscles here. And dermal fillers, those are volumizers. PDO threads, they can be lifting for a physical lift. They can be collagen biostimulation with smooth PDO threads. We can involve all of this together, but none of them really go ahead and resurface the skin here. And that's why putting all of these things together are so important to get your patients the best results. All righty, so let's go ahead and let me just get this to work again. Give me 1 second. Let me come back on the screen. All right, here we go. Start video. Okay, you should be able to see me. There we go. Okay, we are good to go. And again, take a look at this patient. This is a great example of a patient that has had Botox, fillers, and skin resurfacing, has had everything. Look at this area, the perioral area. That is the area completely changed. And that is what we're talking about when it comes to lip lines and smile lines. And again, in most states, you can treat the oral maxillofacial area, and that is what's important for all of that. So there's so much really that we can go ahead and do. So now let's get a little bit more into the nitty gritty here. If I can get my screen to start moving here. Lots of different laser wavelengths, and almost so many of these slides probably spend an hour. And by the way, our fractional skin laser resurfacing is a very comprehensive course. It's 10 to 12 CMEs, and there's a lot of information that you need to know. But what is so special about the way we're doing it with YSGG, with the BioLace, the fractional handpiece, as you're going to go ahead and see, is it's got water. It is so much more comfortable. If you go ahead and Google fractional, laser, you are going to see some of the most gory pictures that you have ever seen when it comes to some of these procedures there. And this takes all of that out of there and does an amazing job, really does an amazing job. And they're calling it the Waterlace Renew Skin Resurfacing. And I should have mentioned this right before that last video, but you'll certainly start to see it in some of the videos coming up. Watch carefully at the skin and see all of those microchannels that are being developed. That is the microbeams that are causing these real micro traumas in this. Different than other fractional CO2 lasers and lasers like that, would literally do so much damage to the skin, and then they're basically regrowing new skin, but they cannot leave the house or are in tremendous amount of pain for 2 to 3 weeks. This is a whole different wavelength. It's a whole different procedure, and certainly fits very well with everything that we do in the AFE and with again, what we're trying to accomplish. And this is what you're trying to do. You're talking about ablation, and you are talking about going ahead and coagulation and very, very even microchannels in the skin. And it's really just amazing. And the water just makes it comfortable. The water just washes it all away. We're going to go through patient fees. We're going to go through all the different, we're going to go through settings. We're going to go through all of that as you're going to see coming up. But again, if you look at the micrographs on the right side of your screen, you can see this is exactly what happens. It's going to create these microchannels. And as they go ahead and fill back up, that's new collagen. And we're going to add something else that's going to really supercharge the collagen biostimulation, because collagen is everything today when it comes to what people look like. But this does it really well. I mean, it does it better than just anything else that we've ever gone ahead and done here. So what can you go ahead and treat with these conditions here? And certainly you will show you lots of before and afters that'll come up. Skin dullness, fine lines and wrinkles, lip lines and smile lines, acne scars. I mean, all kinds of different things. Skin rejuvenation, collagen biostimulation, sun damage, sunspots, a lot of things. It's not for treating all kinds of dermatological conditions. That's not what we're doing it for. But certainly we are dentists and we treat the face. And when you treat the face, the skin is a good part of the face. What doesn't it treat, or when should you not be doing this? Sorry for the gory pictures here as well. Systemic diseases, if it's not a healthy patient, if it's, you know, a real dermatologic disease, an acute acne outbreak, open wounds, cancer history, cancer pregnancy, all the different things that you would normally do. Tattoos, obviously, can't be putting lasers on tattoos unless you're getting a tattoo removal laser, which is not this. Or, you know, different skin types. The darker the skin types, the more challenging these cases can go ahead and be for all of these things. What are the side effects and the complications? Well, you're using a laser device on skin, so you've got to be well trained. Again, that's where the AFE and BioLase come in. Side effects are pretty rare, but it can be discomfort. If you're too aggressive, it certainly can be discomfort, although we do use a topical anesthetic called the ComfortTox BLT by StatTDS.com, a burning sensation, which I'm going to show you a patient that patient that you just saw. I'm going to show you her post-care interview, after a couple of days, and she'll go through some of this as well. I mean, if you're not in a clean area, infection, delayed healing, prolonged redness, scarring, all things that are mitigated by correct technique, correct training, and knowing how these things go. But certainly, some patients can have an overreaction like anything that you do in dentistry, right? I mean, certainly that's it, but it is pretty rare to go ahead and do that for that. But it's really about combination treatments. And by the way, I'm listing just the injectable combination treatments here. I mean, a patient like this who has had all these things, neurotoxins, fillers, lifting PDO threads that give a physical lift, and fractional skin laser resurfacing, has had all of these things. It's really about regenerative aesthetics here and putting it all together. It's not just about this or that and what can this or that do by itself. Nothing exists in a vacuum. Same thing in the mouth with dentistry, right? Whatever you do on one side, occlusion is the perfect example. You can't just do occlusion on the upper teeth or on the right side of the mouth, right? It's all together, and teeth are also part of the face. So that's certainly what we talk about when we're talking about combination therapy for all of these things here. Getting the patient ready here, and certainly you're going to evaluate the patient and really make sure they're ready pre-op photographs, informed consent, all these things the AFE goes ahead and teaches you. Shave hair, unless it's very fine hair, that's not a problem. Topical anesthetic if needed. And a lot of patients, because of the water, and that's what makes this so special, this fractional handpiece so special, that the water, yeah, I mean, even without topical anesthetic, many of them don't need really much as well. Clean the skin. It's got to be so clean. You're going to clean it and clean it and clean it again, and then make sure that it is very, very dry. So that is all of these things right here. That's really important to make sure that you have got a very, very clean surface to go ahead and do this. Now, the settings are, and you know, I've been a laser dentist for probably 25, 30 years already at this point in time. And you go to, you go to a laser session, a laser convention, or you get together with a bunch of laser dentists, and everyone is fighting. I've seen people almost come to fist blows saying that, no, my settings are better for cavity preparation. My settings are better for this, for that, and it's hard to standardize that in the mouth. And we all kind of develop our own way through it. When I first got, and many of you who have lasers will certainly understand this. When you first get it, you talk to a bunch of people, everyone's got different settings for this. Then you kind of find your own groove. And I was making it my mission to standardize settings for that. And it's like, you know what, you're going to have to try things out when everyone can get a range of settings, try things out, and then you see what works in your hands. The difference here is these are very, very prescribed settings. So you really don't have a lot to think about when it goes for this. And certainly the only thing that really changes in the settings is going to be the wattage, whether it's 3 watts up to 8 watts maximum when you're dealing with the face. If it's thinner skin, you're going to be about 3, 4, maybe 5 watts, whatever the patient can tolerate without it actually hurting. Like they can tell you it's getting a little warm, that's pretty much where you stop. Some of the other areas that we treat, especially like the neck, you can certainly get up to 6, 7, 8 watts with no problem. It's how thick is the epidermis and dermis. And again, we know that on patients. So it's much different experience. Your air is always going to be at 50%. Your water is going to be at 20. Your Hertz is going to be at 15. You're never going to change those settings pretty much. The water, again, if there's a lot coming out, you can dial it back just a little bit for that. So there's not a lot. It's really, really well defined for that. We always test on a patient's hand first, by the way, which is really nice. And this way they get an understanding of what the sound, what it's going to feel like, the water coming out. We just do a couple of those tracks on their hands, and many of them like it because they say, oh my God, they come back like, a week or 2 weeks later saying, oh my, that part of the hand that you treated, feels so smooth, which is great, but we don't treat hands. It's just for a test. Or you can test behind the ear for that as well. Now, they come with disposable applicators, and that is important for that. And that is for safety, and that is for sterility. That's pretty much for everything. And every once in a while, I think I just mentioned that, you need a second applicator, but generally one applicator will do the entire face and neck and everything that we're going to go ahead and do. But, you always want to look at it, check it, make sure it's not getting clogged up, it doesn't use. And this just snaps on, snaps off between procedures there for all of that. When you're doing the procedure, this is really, really important here, is you want to go ahead and stay perpendicular to the skin. Now, don't forget, the face has got different shapes. So you've got to adapt and make sure you stay perpendicular to the skin. The water spray is going to come out on this photograph on the right side of that, right? And then you are going to follow towards the water. So the water is always leading as you're going ahead and doing this. And the best way to describe it, like how hard should you be on the tissue here? You should be gently touching the tissue. The best way to go ahead and describe this really is about floating on the tissue here. And that really gives you a good idea of what you should be going. And then, again, this is a graphic, so you can see there, but put it on there, and then you want to go ahead, start moving the handpiece before you press the foot switch and start firing the laser there. So you never want to go ahead and be smack on on the tissue and push that foot pedal down and just burn that tissue. You want to always constantly be moving as you go ahead. And you're going to go ahead along these tracks on the face, and you're going to overlap just anywhere between 5 to 10%, because you do not want a lane of untreated tissue between a lot of different tracks that you're going to go ahead and do. So you're going to pretty much see that as we got this coming up for this. And it's about, again, a lot of the tips that you'll learn in training is really going to be, and it's a set depth already. It's about 1 millimeter to 1.5 millimeters in terms of how deep you're going to go for all of that. But what you've got to develop is the kind of like the right flow. If you go too fast, you're not going to get even microchannels or the depth of penetration that you need. If you go too slow, you can get a lot of redness or burn tissue. So this is really about, we say 15 millimeters per second. You'll develop that flow, and you'll certainly see it in all of these things coming up, including in this right here. So you can go ahead and see this right here.
Can I have a gauze? Thank you. Sorry, pain.
Oh, no, you're fine.
Turn her neck, turn her head. All right, so you get the idea of what is happening right there. You get the idea of what's happening right there. And this is what it should look like. And we're going to go to a treatment video here, a pretty extensive treatment video, so you can go ahead and see that here. But this is really what it should look like if you look at it pretty close up. That is what you are trying to accomplish here. And that is what's going to give you a fantastic, fantastic result here. So let's go to a video so you can go ahead and see the procedure in more detail here. Here we go. Now the jawline and chin area. There you see a real good example close up of those microchannels being created with the tracks along there. You want to go ahead and make sure, follow the contours of the face. That is super, super important. If you go slower than that, you could possibly cause more damage than you need. If you go faster than this, you're really not going to go ahead and be delivering the treatment that you want to go ahead and leave. And again, don't go over the same area at all, but make sure you are watching and knowing exactly the areas that you are going over. Now here, we're still at about 8 watts. And again, this area can take it, just make it comfortable for the patient. So it's really easy to see when you have the higher wattage, exactly the areas that you are treating. And you can see how reactive that neck is and how reactive the corner of the jawline is, looking really good, and the chin area there as well. So that's where we're going to have the higher wattage. As we go to other parts of the face, though, now we're going to go ahead and turn that down just a little bit as soon as we are done with all of these different areas. So you've got to work on a dry surface. So again, if you're going to other parts of the face, now you're going to go ahead and deal with some of the dry surface that's there as well here. So that is looking really good. Now we are going onto the face, again, also going along that jawline so you can really see what's going here. Here we did now turn down the wattage just a little bit because this is a little bit thinner tissue, and this is the area we're going to start coming to where we put in those smooth PDO threads. Now with those smooth PDO threads, we are going to go a little bit slower, because going a little bit slower exactly in that area where we have those smooth PDO threads is going to heat them up just a little bit to really activate them. And the combination of going from the inside out and building the collagen biostimulation with solid filler smooth PDO threads, which are probably one of the best collagen biostimulators and elastin biostimulators that are out there, really create a lot, will give support to that skin. And you can even see, even with the lower wattage, you're starting to see those microchannels being created along this area. We're still over the area a little bit slower with the solid filler smooth PDO threads when you do them at one appointment. You can even do this if those smooth PDO threads were put
in a couple of weeks ago, it's wise to go a little slower over that area, get a little bit more of that heat that is going to work its way down in the tissue and will help stimulate those solid filler smooth PO threads, because as they break down, that's when they produce collagen here. So once you're past that point, now you can go back to the regular speed as we were doing there. Just keep following the contours of the face there. And you can really see as we're pointing out different areas. 10% overlap, that doesn't change no matter where you are on the face there. And keep patting it dry, because you do want to, when you start this fractional laser, you do want to go ahead and start it on dry skin ideally. If you start it on wet skin, that's okay, because the water gets activated as part of the laser. Also, just a reminder, always have the water in front as you are pulling this laser over it to these different areas here. Now we're getting to the forehead. Even though it's a little thinner skin, it can take a decent amount of wattage here, and that's what we are accomplishing as we go there. This area, I mean, they're all a little bit challenging, but, you know, the area of the neck and under the chin and under right along the jawline is a little bit more fleshy. There's a little bit more skin. So you get to the forehead, you want to make sure you're maintaining the right speed there, because it's thinner, not really thin epidermal cells, but because the whole area is thinner there, you want to make sure you are not dilly-dallying over any particular area for too long here. And never going over the eyebrows, never going into the hairline, up to the hairline, never going into the hair, I should say, is what we want to do. So you're not treating hair. This isn't hair removal, although it is going to smell a little bit like hair removal, because there is going to be a little bit of a burning smell that you will smell, and again, prepare the patient for it. And to many patients that have had some kind of laser hair removal, they will notice that smell there as well. But we're not dealing with hair here, so get up to the hairline, but you are not going to interact with hair at all. So now let's go down to the areas around the crow's feet here, temple area. We're just going to keep doing those same strokes at that same speed and getting the same results. Turn down the wattage a little bit right here for these areas. These get a little bit more of this is thinner skin and a little bit more reactive. So you want reactive, but you don't want too reactive. You certainly don't want pain, and the patient can certainly keep giving you feedback. This patient's been talking a lot through the procedure for that. And this is really good. With the other hand, really try to give the skin some tension so you really can do longer strokes, makes it a little bit easier to go treat here. But this whole treatment, you're seeing a full face treatment, and it'll be 11 minutes or something like that. And we're going to show you some of her before and after there too. Now we're going, again, over those areas that we just passed it a little bit, going over those areas that have the smooth PDO threads in a different direction than we did on the other side, a little bit slower motion there. So then we just want to build up a little bit more heat, not enough to burn the patient, but to activate those threads. And that's what we are dealing with here. So now around the mouth, make sure you do this well and have the patients, you're never going over lips. That is a real no-fly zone for that, but you want to go right up to the vermilion part of the lip, get all of the cutaneous skin tissue around the lips, and this is the way to do it. Have them invert their lips so you can get everywhere close and around the lips. And at this point, we have turned the laser down to probably around 3 watts, 3.5 watts. This can be a little bit more of a spicy area there, so you want to make sure that the patient is comfortable here. But, this is a good shot as you take a look at this patient as we're doing our final touches on there. Some areas look more reactive, and that's because they've had a higher wattage. Other areas, by our choice or the patient's choice, had lower wattage, so it may not be as reactive, but they're all getting that fine treatment. Now, in this area, this is, again, also a little bit more of a thinner tissue area, definitely about 3 watts for most patients, as you see here, and as the patient's going through all of this right here. A little hard to see, just because it's hard to get a good angle on all of this. But the patient, you see, has done very well, has talked through a lot of this procedure with us there, and just keep going over that area. Again, as you go over some of that area with the smooth PO threads, just a little bit slower, and it all really goes so fast. This is even slowed down a little bit because because we're doing this for teaching purposes there as well. Don't forget the nose. The nose has skin too. You want to get as much or all of the skin on the patient's face so it's all getting a uniform treatment here. And now we're finishing up these areas here. So make sure that it's all about wattage, it's about settings, it's about anatomy, it's about understanding how you can get the best results with fractional laser skin resurfacing here. And now let's go to some of her before and afters. And this is combination before and after. She's had a lot of treatment done. Neurotoxin, fillers, lifting PDO threads, but where that skin is looking great and nice and tight is from solid filler, smooth PDO threads. She's had even more than what you've seen in this video at other treatments here, and fractional laser skin resurfacing. Look at the difference in that tissue, in that tightness. Some of that is lifting PDO threads, but the quality of the skin, the tightness of the skin, that is certainly going to come from building collagen from the inside out with smooth PDO threads and from the outside in with fractional laser skin resurfacing. Two great modalities, but even greater when you do these together and get the best effect here.
All right, so I'm not going to come back on because I'm going to go to pretty much another video right away here. But let's talk about post-treatment healing, and I'm going to show you the patient that we treated before about all of this. So you can see it. I mean, again, for most patients, it's very tolerable. They're going to be, they have some redness, the noticeable microchannels, which will start to heal up fairly quickly there as well. Some dryness, maybe a burning sensation. Post-care is super important, whether it's Aquaphor, which is just like it's like a very heavy Vaseline, or something called Comfortox Restore that we teach in our course that was specially made for post-laser treatment that we give to every single patient. So let me have a patient describe it, because this is important. It's going to be about patient management. Certainly this is going to be important. So here we go.
After, I felt fine, covered my face in Aquaphor, and then about an hour after, when I went home, that's when I kind of felt like I had a sunburn, redness, just kind of irritation. Felt like, I had just spent the day out in the sun. Put some more Aquaphor on, went to bed, and haven't been red or, inflamed or irritated since.
So, and take us through, so that was day one, day two, no makeup, right? Or just keeping moisturized for that. And what did you use for moisturizer after the Aquaphor, like the next subsequent days there?
The next couple days I kept it no makeup for 48 hours. And I just used a gentle cleanser, and I would switch between Aquaphor and CeraVe just because I felt like it was a thick, kind of softer, creamier moisturizer than Aquaphor. But other than that, I haven't used anything crazy other than gentle cleanser and CeraVe.
Right, and very, very light makeup here,
right?
So what should she be doing, Sydney, now going forward here after 7 days? I mean, she's still got some track marks, so she has a little bit of healing here for that.
Yeah, it seems, Ariana's our ideal patient and candidate because she does kind of follow all of those guidelines that are in place. So she's been doing all the right things, kind of just listening to her skin, holding off on any heavy makeup, retinols, anything aggressive that's going to irritate the skin further. And we kind of talked prior to filming this and kind of when she might start reintroducing her normal skincare. And for right now, until these check marks go away, so maybe a week to 2 weeks, these will still be present. Once those go away, she can kind of resume her normal skincare. It's like anything, it's a little irritated at the moment, not anything horrible by any means, but she's kind of just treating it really gently and listening to it. And like Dr. Maltzmacher said, really light makeup, nothing crazy. She doesn't want to irritate the skin in any way. So just keeping it really light and gentle. It's healing really, really great. At this point, kind of where you are in the camera, you can barely even tell that anything is done. She looks fabulous. It's not until you zoom in and get really close that you can tell that those track marks are still there.
Right, and I want to go back just to one more thing, but so turn towards me just a little bit, and let's go back to show you these track marks. And this is what we continually say. First of all, for fractional laser skin resurfacing, the reason that it is so much different than other YSGG or any other fractional laser skin resurfacing is because of the water that comes with this procedure. And again, that takes away a lot of the pain during the procedure for that. But it's also, and again, as you visualize these track marks, remember these are all well-placed microchannels into the skin. That's the ablation. And when I keep talking about that perfect blend of coagulation and ablation, the ablation goes down into the skin, causes that microchannel, but it doesn't do so where it just totally, eviscerates the tissue in these microchannels. You get some coagulation, which is the healing process. There are other lasers that do skin resurfacing that will just evaporate the tissue, and it's, you're just about ablation and the coagulation is just a mess, or it's all about coagulation and very little about the ablation process. Those two things have got to go together. So that's why she is getting this, and that's what we're going to find everywhere. The softness she has here, she's going to have everywhere. It's going to be nice and smooth. She's post inflammatory hyperpigmentation we're not worried about with her because she is a younger patient here. I'm just going to sit you back up here for a second. And what are you taking again? We talked a little bit about you do something for anti-hyperpigmentation.
Yeah, in the morning I'll use a vitamin C serum normally, and then something to kind of help with any discoloration or to bring any of the hyperpigmentation to the surface. I have not been doing that until these track marks, like Sid said, kind of go away. I've just been keeping it very gentle the past week.
Right, and that is, the other important point about the hyperpigmentation is that on a younger patient to do, even with a type 3 and above, but she's a type 3, type 4, somewhere in between, younger patients suppress their melanin. So we're not as worried about post-inflammatory hyperpigmentation as we would be if she was an older patient. You'll get there someday, but she may always end up looking like this if she continues on. That, fractional skin laser resurfacing and botulinum toxin, dermal fillers, and MPO threads, collagen biostimulation. So that's what it's all about. So we'll keep tracking this, but now you know what it's like for a young patient, type 3, type 4, and what their experience is going to be. So thank you, Ariana. Thank you, Sydney, for putting this together.
And by the way, we'll, as part of this course, we train you in all of those different things there. I mean, the retinols and all those different things, you really need to know what those things are going on. All right, let's talk about solid fillers, PDO threads. This is part of the course that we teach because, as you've heard on some of these cases, it's not just about the fractional skin laser resurfacing going from the top down. It's about building collagen from the bottom up. So these two will meet. Now, the laser skin resurfacing will go ahead and give you some collagen right underneath the epidermal layer here, and that's what causes some of that skin tightening. But we couple these things together. And again, when we teach this course, it's about collagen biostimulation. So the quickest little thing about, if you're not familiar with PDO threads, and we certainly use something by Vsoft Lift, the best collagen biostimulation PDO thread. And you'll see, very easy to put in. You've been a dentist for a long time or not a long time. You do much harder procedures than what you're going to see when you're properly trained. And all a PDO thread is just polydioxanone. It's a suture material. It's been used in 50 years in dentistry, medicine for that. And it's a slowly absorbable thread that takes about 4 to 6 weeks to absorb. But when you use it in the skin in what's called the subdermal plane, we'll just show you what it looks like. And take a look at this micrograph. This is a cross section. So you see the threads on the bottom. Above it is regenerated collagen by the body's natural reaction as these threads start to break down. That's what you will go ahead and get. The top is epidermis. So imagine that we're using fractional skin laser resurfacing with the Renew from the top down, and now this is from the bottom up, and this is how you get unbelievable results, much better than if you did a fractional CO2 laser, if you know what that is, which is, again, much more aggressive and all those things. I'm going to show you a quick video, even if this is brand new to you. That's where we're going to put it in what's called the subdermal space. It's just a few millimeters down. It's about going in at the right angle for that this is kind of what the procedure goes ahead and looks like when you're doing it, but I'd rather just show you. I mean, I'm going to show you on that patient that we did the laser. By the way, we did this all in one appointment for this patient. We actually do the threads first, and then we go back with the laser. So this what I'm showing you is a little bit out of order, but let me show you a quick threads treatment. There's just a few minutes of that, and then we're gonna show you before and afters and talk about patient fees and all those different things. So here we go.
Smile for me.
Okay, so we are starting to mark up and treatment plan Mandy's smooth threads. So as you can see, she kind of had Mandy animate and smile to see where the majority of the laxity is in her skin. So that's where we're gonna focus the smooth threads on. You can mark this side too if you want. We're doing 5 and 5 on either side, and we are using the Vsoft 29 gauge by 30 millimeter length smooth threads, placing 5 per side. And you can see she's trying to get a little bit of a crosshatch happening so that we can layer the threads and get as much collagen spread in that area that we're trying to focus on. So now that she has a little bit of a treatment plan marked up, she's gonna go ahead and start the procedure. So when we are inserting these, we're always making sure that the bevel is up. You can see she's kind of pulling the skin down nicely and then bunching it up as she is furthering the thread into the skin. And Mandy is a superstar. She just sits through every procedure we ever do to her like a champ. So once the bevel of the needle is kind of through the skin, Ariana is just advancing it straight in all the way to the hub. We typically recommend advancing the thread as close to the hub as possible, just so that the thread actually stays under the skin where we want it to stay. And now you can see she's doing a little bit of a crosshatch. So it's completely normal if you leave the threads in as you're advancing these to meet a little bit of resistance, because you will kind of hit those other threads. But again, getting it as close to the hub as possible. And once she gets all 5 placed, we will twist them so that they engage and kind of start to cause that little bit of micro trauma to the area. And then we'll put gentle pressure over the distal end of the needle and remove. Beautiful. Okay, so now that they're all in, she's gonna twist the hub 360 degrees. It does not matter which way you twist these, you just have to make sure you do an entire 360. And then you can see she's putting gentle pressure over the distal end of the needle as she removes to ensure that the thread stays behind. Beautiful, and then she's gonna do the same thing on the other side. Okay, so now we're getting started on the other side. As you can see, she's going at it at a little bit of a different angle. So on the other side, she started at the bottom. This side, she's starting at the top. It truly does not matter. Whatever is comfortable for you will work just fine. So from this side compared to the other side, Ariana is the one who is placing the threads, and she kind of noticed that Mandy's skin is a little bit tough to get through, which we didn't warn her about, but Mandy has a history of some severe acne scarring, and obviously you can see that she's come a very long way with the treatments we have done for her, but it definitely makes placing smooth threads a little bit more difficult. So as you can see, as she's advancing it, you can see she's giving it like a little extra oomph, a little extra push to get in there. Once she kind of gets that bevel through the epidermis and then we're in that subdermal plane, it really does advance nicely. However, patients that have a history of any kind of scarring, whether it's from acne or surgery or a traumatic event or injury, something like that, it's going to be a little bit more difficult to place. So you just have to really pull the skin tight and give it a little extra push as you are advancing.
As well, you can see that we're only using 5 threads per side, which is kind of an awesome benefit of the V-Soft threads, because we can get away with using a lot less than maybe other brands where we're using 10 to 15 per side to get the same results, because they do really produce enough collagen just by using 5. So that's why we're choosing to only do 5 per side. And then we're gonna go in with the fractional laser right after this. And she will be good to go. And that is it.
All right. And so hang on a second. So, and so let's just talk about her before and after here, because really it's so exciting what you can really do about this. And really, when you see her before and after, you really begin to understand this is all dentistry. I mean, this is literally changing the face of dentistry, because look at her smile lines, look at her lip lines. She'll show more teeth. I can whiten teeth. I can put veneers on teeth. We can do all those things. So again, in this appointment, and most of these appointments are like this. And again, this is the way we treat it, because we want the best of collagen biostimulation. We want the best of laser skin resurfacing, skin tightening, all those things. That really transforms the face, and all of that relates certainly to lip lines, smile lines, and everything else like that. The laser actually activates those threads, so it's really kind of nice of what you can do. So now we'll talk about patient fee for threads first. That literally 5 to 7 minute procedure. You can see your cost of the threads. And again, this is for 10 threads on each side is $100. The patient fee is typically $650 to $850 per treatment. So let's just say $750. Treatment time is like no time at all, a few minutes here. Then we repeat it every 4 to 6 weeks as needed. Some patients need just 1 treatment. Some patients need 3 treatments. And the results, collagen, will last as long as the patient's collagen will last, 12 to 24 months. This is not laser skin resurfacing. That we're going to get to patient fees for that. And literally, I could show you, I mean, hundreds and hundreds, if not thousands, of before and afters on young patients, on older patients. Again, they didn't just get one thing, but they certainly benefited from there are 4 parts of this, and it's Botox, neurotoxin, it is fillers, it's lifting and smooth PDO threads, and it's laser skin resurfacing for that. What you just saw was a mother and daughter, by the way, for that. So you can see this goes across all ages of what you can really go ahead and do. Follow-up visits, as you saw, we usually do a 2-day, a week to 2 weeks later as they need to monitor the healing and the progress. Make sure you're doing enhancements if needed. Make sure you're taking photos to monitor the progress there as well. Now, fractional laser skin resurfacing patient fee ranges for all of that. And there really is, there's no insurance involved. It's your skill. It's your time. It is, the cost. You've invested in a laser. You've invested in your training. I mean, if you see competitively what these things are going for, it's anywhere from $1,000 to $2,500 per session. How many sessions do they need? They usually need between 2 to 3 sessions. If it's a little bit tougher case, they need 4 to 5 sessions. So again, you can do bundle pricing. You can bundle with other aesthetic treatments, as we do with smooth PDO threads. As you just saw, in a typical case like Mandy, or like that young gal that you saw before, we're doing both of these things together. It's easily a $2,000, $2,200 with laser skin resurfacing and PDO threads together. Again, if they pay up front for a bundle of 3 sessions, then you can reduce the pricing a little bit. In terms of ROI, there is no bigger ROI than when in the time involvement, which for a full laser skin resurfacing plus PDO, laser skin resurfacing, 20 minutes. With PDO threads, 30 minutes. Okay. There's nothing in there. There's no lab fee, right? I mean, pretty much you're investing in your skill and training, and you invested in a laser. And those of you who already have, the I Plus, then this is an extra handpiece that goes on the I Plus. You've already made that investment. I mean, there's nothing in dentistry that comes close. Compare it to your crowns, your implants. All those things take a lot of time. Yeah, don't be fooled by the high fee. I give courses on this all the time, and this could be a whole separate course. Just because you have a high fee from an implant case or a veneer case, your time involvement is a lot, right? the healing time and getting the patients into it. It's 6 months for the implants to integrate, and then you got to finish the case. There is nothing that comes close to this when the time, ROI, investment. There's nothing that comes close to injectables and also this kind of treatment there as well. So that is how we look at it there. Again, we will teach you how to do the whole scope of practice thing, how to document it appropriately for all those things as we talked about before. But I'll just show you a bunch of before and afters here. It's about total facial aesthetics, young patients, older patients, and all of these improve the lip and smile lines. You improve the smiles. You show more teeth. I mean, look, these cases are really unbelievable. And how do you show more teeth with all these things? Well, what happens as you age? With especially this, your upper lip gets longer. Everybody knows if you're in dentistry for a week, you know that patients who are 10, 20, 30 years old, when they smile and talk, you see upper teeth. As they get older, because everything on the face sags and the upper lip falls down, you only see lower teeth. So this is just incredible what you can go ahead, and I could just show you many transformations of before and after of patients of all ages. Okay, this young lady is 75 years young, and she wanted injectables, she wanted laser skin resurfacing, and truth be told, once you really understand what injectables and everything can do, you really also get trained in, well, is she better off with a facelift? And by the way, why does a 75-year-old want this kind of treatment? Because she's dating. Okay, she's buried 2 husbands already. She's gonna live till 120 years old. She's on the market again. I mean, she's dating. She wants to look better. So we told her she's really borderline facelift. Maybe she should go. She says, I don't want a facelift. I don't want surgery. Let's see how far we can get with Botox, with fillers, with PDO threads, with laser skin resurfacing. Pretty far. She was very happy. It shocked me. I mean, it's taught me a lesson too, but you got to give them all the options, and you got to get trained in all of those different kinds of things there. So with that, we'll take questions in a second, but let me just do this, because I do want to make one offer specifically to all of you on this webinar if you're thinking about injectables too, but definitely follow the AFE on all the social media channels. Here's this. If you want to take a picture of this, we have an online program on the AFE's website. facialaesthetics.org and product, and look for something called facial aesthetic dentistry. If you're not into injectables like Botox and fillers yet, you can get this course for free if you use coupon code BIOLACE99. So just take a picture of that real quickly. And AV training, a lot of questions for you on AV training. By all means, just go to afetraining.com. Let me just show you when these courses are coming up again. And BioLace, by the way, when you buy a fractional handpiece or buy a laser with a fractional handpiece, I guess they will give you a tuition voucher to come to one of these training courses there as well. So the next one's coming up in addition to all of our regular training there as well, as you can see. You can see the bold there in December, in February, in March. I think the December one is just about full. There might be 1 or 2 spots left, but then February and March coming up there as well. So with that, I'm just going to put up this slide, and Joseph is ready to go. I'm sorry we went a few minutes over for that, but
okay.
let's take some questions, and then we'll go from there. And there's my email, though, for those of you who want to follow up there as well. So I appreciate you guys being on in your time, but we'll probably have some interesting questions here too.
Well, you know what, Dr. Malkmacher, you have presented great information when, when you have basically answered the questions that were posed as you were presenting. So I've just reviewed the questions again to make sure that I didn't miss anything, but I believe for the most part that you answered most of them in your presentation. Now, one thing that I thought was an interesting question that we did not get to is there was a question in the chat about recommendations on using low-level laser therapy to help with healing. Have you ever used like a diode laser for low-level laser therapy for healing and something like this?
So we don't recommend that for this kind of healing there, because you want You really want the body to heal on its own without a lot of extra help and really develop better collagen for that. There's no good studies that show that low-level laser is good or bad for this. And so when in doubt, it's not something that we want to do. We don't want it to heal up too fast. That's the honest truth. We really want the regenerative power of the body to really go ahead and do this. And there are other things you can use. I mean, somebody I saw mentioned in the chat there as well about exosomes. Now, exosomes, if you don't know what they are really new. It's the Wild West out there. You've got to be very careful with exosomes because none of it is FDA cleared yet for injections, and we're not exactly sure which companies are on the up and up for all of those things. I mean, it's it's kind of crazy what's going on. But let me put it this way: low-level laser therapy doesn't hurt. I'm not sure that it really helps that much. And so it's just going to take a lot of extra time and that kind of thing. So, but I don't think it would actually hurt. I mean, you've got there's actually something called low-level light therapy there as well. You're not going to have that much of a problem. The healing is really pretty simple. And the truth of the matter is, when they get that dryness, a slight burning sensation, they've invested a lot of money in these procedures. It's okay to let them kind of feel that it's working, right? I mean, it's really okay for all of that. And they appreciate that. They're really comfortable. There's something called a product called ComfortDox Restore that we use on all of our laser patients. You can get it from statdds.com. If you look up statdds.com, the entire ComfortDox line for injectables and post-treatments and post-care. That is very soothing, very healing, and it really, again, helps healing there as well of that. Nothing wrong with letting the patients know something was done, because the worst thing you want to say is for them to say, "Oh God, no different. Like I didn't feel anything like during the whole thing for this." This is a very acceptable healing for all of that. But I just want to go to Jennifer's. Has a great question here. Why would a patient go to the dentist as opposed to a med spa or a plastic surgery office? That's a great question. You know why? And we've seen this in 15 years of the AAFE and training. Again, tens of thousands of dentists. Dentists explode their practice with injectables and skin resurfacing and all these things. Dentists, you have a much better relationship with your patients than anybody else out there because they see you on a regular basis. They trust you, and you've done a lot of work on their face and in their mouth, and they know how precise you are. We have seen this time and time again. Dentists probably are the leaders in facial aesthetics in the United States. There are more dentists doing it than there are plastic surgeons, because there are only 15,000 plastic surgeons and dermatologists in the United States, and not all of them do aesthetics, believe it or not, because many of them just do the medical part of all of this. There are many more dentists now doing this, and so this is not even an issue. I mean, literally not even an issue for all of that. But that was a great question there, Jennifer. But there is, Joseph, and you can handle this, the cost for the fractional laser handpiece. I know a few people have asked there too. I don't know if you've answered that.
Yeah, so well, I was going to address that real quick as we get into our closing slides here. There have been a couple questions about the specifics of the fractional handpiece and specifics about the type of water-lased lasers that it attaches to, pricing, specs on it. Those types of questions can be answered offline, and I'll give you, and I apologize to my audience that I'm starting to lose my voice here, but I will give you some instructions on how you can submit questions to BioLays to help answer those questions. So with that, since we are approaching our time here, if you don't mind, Dr. Malkmacher, I'm going to go through some of our closing information, and to our audience, if you would please hold on here, I'll give you instructions on CE. Before I do that, Dr. Malkmacher, thank you so much for the wonderful presentation and the wonderful content information you gave. As you were talking, lots of chatter on the chat and the Q&A. I could tell everyone was very engaged and very interested in the information that you presented out. So thank you for that. To our audience, if you want to find more information, okay, there's a couple websites you can go to. The easiest one is biolays.com/renew. So as Dr. Malkmacher mentioned, it is called the Waterlays Renew Skin Resurfacing handpiece. For more education on the Biolays side, you can go to education.biolays.com, and let's look at Renew real quick. So biolays.com/renew. Now, this is on Biolays' website. If you want to look at some more of the features and benefits of this technology, watch an animation video, submit your information for to be contacted by our staff. This is where you can go to find that additional information. If you want more information about just education for your Waterlays, or if you have our diode technology or diode, go to education.biolays.com. And I mentioned at the beginning of our time together this evening that we have a couple courses coming up, and that's with the Waterlays Academy. So when you go to Waterlays Academy, you can find a plethora of information, from clinical animation videos to webinars like this that are recorded in our webinar library. But courses you'll find are our first course of next year will be our foundations course at our beautiful training facility in Southern California on January 12th and 13th. And then we have a Waterlays Advanced Mastery course on February 2nd and 3rd. If you want to take a deeper dive into restorative care with your Waterlays, that's going to be the course for you. And then I did want to mention, Dr. Malkmacher reviewed these courses on his slide, but our upcoming fractional courses, now he mentioned this, but when you purchase the fractional handpiece for your laser, his training with the AAFE comes with it. And his trainings that are coming up, the first one is on December 1st at our training facility there in Southern California. I think he said there's only 1 or 2 slots left. The next one is on February 16th. And then the next one after that is at their training facility outside of Cleveland, Ohio on March 29th. And you can find that information at their website there at facialaesthetics.org. And you go to courses and you'll see the fractional YSGG laser therapy skin resurfacing certification training. Our next webinar is December 5th. That'll come up here in a couple of weeks. It's a great topic to wrap up the year, focused on social media, especially if you have a laser, if you are integrating fractional skin resurfacing into your practice, if you have other state-of-the-art technology that you're trying to integrate into your practice. How do you properly market that through social media? That's what Allison is going to be speaking about on December 5th. Excited about that content. I hope you'll be able to join us. Okay, so that is it. This recording will be in our webinar library within the next day or two, either education.biolays.com or biolays.com/webinars. Now, if you have more questions, or if I accidentally missed your question, please email us at education@biolays.com, and we will address your question and get you the resources that you need. Again, Dr. Malkmacher, thank you for your time and your expertise and your wonderful information. To our audience, thank you for joining us, and we hope that you will join us again in the near future. Take care.
Right.
Thanks,
everybody.